everyone, this is Derek. This is month 10 post laminectomy discectomy. Some of you have been asking for some updates, so this is almost exactly 10 months after my laminectomy discectomy. I just wanted to make a couple points. I ran my first mile on the beach yesterday. I just moved down to Florida. I've been doing a lot of swimming, and you know, everybody's recovery is different. So again, I know people that have gotten a surgery and 2 months later they're running, 10 miles. I, on the other hand, I guess it's been a slower recovery than most, but at the same time, I had a pretty high physical standard set for myself prior to this, so I'm probably not going to be happy until I can go, run 5 miles and then work out on top of that. So, I would suggest getting this surgery if you've reached a point in your life where you've tried everything else, where you're in constant pain and you can't function anymore as a human being. I guess you have no other options left, and that's where I was. I guess 6 months after any back injury, I guess 80% of all back injuries fix themselves after 6 months. So you should give your injury time to heal, and if nothing works after you try everything, then I suggest you go get the surgery. That being said, and again, everybody's different. At this point, after 10 months, I've come to the conclusion that, I might not get back to the physical standards that I had prior to injuring myself, which is, I might not be able to pick friends up and put them over my shoulders, or, go pick up big rocks or tire flip or any of that other stuff. But at the same time, living the quality of life that I had prior to getting the surgery was just not acceptable. So again, if you do have the surgery, number one, you really have to give it time. And on top of that, your main function and job is to be able to get to a decent quality of life where you're happy, and you need to be able to get to that quality of life without taking narcotics. That's my second point, where anybody can choke down a handful of Vicodin and feel better for the day, and then most likely they'll re-injure themselves. But your job after getting surgery or trying to nurse your health back to the point where you're functioning again, is to be able to get strong without taking any narcotics. So I suggest checking out gabapentin, which is also called Neurontin, and for pain, try Tramadol, which is a non-narcotic pain medication. So your main function, I understand that sometimes it might be hard for you to be able to get by without any pain medication if your back is really, really bad, and maybe you're just post-surgery or pre-surgery, you can't, function or move without any medication. But again, your main goal to be able to really say that you've almost fully recovered is to be able to function without taking any pain medication. So again, 10 months post-surgery, doing okay, ran for the first time, longer distance, a little bit over a mile on the beach. Again, you just got to take it slow, be smart, cut out the negative, cut out anybody in your life that's not being supportive, and you really need to identify that and try to do this all with the understanding that your main function is to be able to heal and recover without long-term use of narcotics, because that's just not good. Okay, and if anybody has any questions, just message me and I'll try to do one of these for another 2 or 3 months. Okay, thank you. Bye.